This video presentation on hair dye allergy and intolerance is brought to you by healthhype.com. Always consult with a medical doctor about your symptoms and do not change any prescribed treatment without professional advice. Hair dye is a widely used product for coloring hair, but many people have a problem known as a hair dye allergy or intolerance. Let us look at what happens in these conditions and why it occurs. Itching is one of the most common symptoms in hair dye allergies, but this is not a problem with the hair itself. The itching is a sensation from the scalp, which is the skin from where the hair follicles arise. It is important to remember that hair cannot experience any sensation like itching or pain. Tiny nerve endings in the scalp causes sensations like itching, burning or pain. This occurs when the skin becomes irritated, injured and inflamed, which is what happens in a hair dye allergy. However, not every person has a problem with hair dye. Let us look at the chemicals in dye that causes a problem for some people. Hair dye is made up of various different chemicals, such as bleaching agents and colorants. Many of these chemicals can cause irritation, but two specific substances have been identified as the main triggers in hair dye allergies. The first problem chemical in most hair dyes is PPD. This stands for paraphenylene diamine. Paraphenylene diamine is also known by other names like benzene diamine. It is found in most hair dyes and is mixed with peroxide to change hair color. Another chemical known as PTD is also found in many hair dyes and can pose a problem. PTD stands for paratoluene diamine. It is usually better tolerated by most people and is less of a problem than PPD. These chemicals do not only color the hair but also make contact with the scalp. It can then irritate the scalp and trigger inflammation, which causes the itching, burning, pain and red rash that is commonly seen with hair dye problems. A hair dye allergy is a skin condition known as allergic contact dermatitis. It is an allergic reaction when certain substances come into contact with the skin. However, the reaction is not always confined to the scalp. The dye may drip from the scalp onto the rest of the face and cause a reaction there as well. People who are sensitive to dye and color their eyebrows may also experience itching and burning on the eyebrows. The same reaction may occur with coloring the mustache and beard area, although these are less common practices compared to dyeing the scalp hair. Let us look further into a hair dye allergy and intolerance. Although both an allergy and intolerance to hair dye may cause similar symptoms, there is a difference in the mechanism. An allergy is a reaction by the immune system which is abnormally sensitive to a substance. An intolerance is caused by a physical or chemical irritation to the skin. A hair dye allergy only affects sensitive individuals. A hair dye intolerance, on the other hand, can affect any person. However, some people may find irritation occur with just a small amount of dye, whereas others are able to tolerate larger amounts without a reaction. As previously mentioned, a hair dye allergy causes a skin condition known as allergic contact dermatitis. A hair dye intolerance causes a similar condition. This is known as irritant contact dermatitis because the hair dye chemicals irritate the skin. Both allergic contact dermatitis and irritant contact dermatitis cause skin inflammation. It is important to seek medical attention for a hair dye allergy. Some people can have a severe reaction known as anaphylactic shock, which can be life-threatening. It is rare but still a potential risk even if you have used hair dye once in the past. This video was brought to you by healthhype.com. Always consult with your doctor for a proper diagnosis and treatment of your condition. Subscribe to our channel to get updates on our latest videos and visit our website for more information.